Dr. Stuart McGill is a distinguished professor of spine biomechanics at the University of Waterloo. With over 3 decades of experience, Dr. McGill has analyzed the spines of both injured and healthy individuals, developing methods to treat spine injuries and pain while improving spine biomechanics. He has authored more than 250 peer-reviewed research articles on these topics, establishing himself as a world expert in the field. Dr. McGill emphasizes that back pain is a symptom with numerous potential causes and pathways. He explains that genetics loads the gun, exposure pulls the trigger, and the psychosocial environment influences how individuals respond to pain. This multifaceted approach highlights the complexity of back pain and the need for comprehensive assessment and individualized treatment. Dr. McGill discusses the unique anatomy of the spine, explaining why we have evolved to have discs rather than ball and socket joints between vertebrae. He describes how discs provide both flexibility and stability, allowing for a wide range of movements while maintaining control. The professor also delves into the importance of facet joints in guiding motion and how their angles can affect an individual's ability to perform certain movements or sports. The podcast explores how genetic factors influence spine structure and susceptibility to back pain. Dr. McGill uses analogies like comparing different dog breeds to illustrate how individuals may be predisposed to certain types of movements or sports based on their genetic makeup. He discusses how spine thickness, disc shape, and facet joint angles can all play a role in determining an individual's suitability for various activities. Dr. McGill emphasizes the importance of thorough assessment in determining the appropriate treatment for back pain. He describes his approach, which includes gathering detailed information about the patient's history, pain triggers, and goals. This comprehensive assessment allows for a more targeted and effective treatment plan. The professor also discusses the concept of virtual surgery, a technique he uses to help patients who have been told surgery is their only option. The podcast covers Dr. McGill's famous Big Three exercises: the bird dog, the curl up, and the side plank. These exercises are designed to build strength and stability around the spine and have helped many people avoid or rehabilitate back pain. Dr. McGill explains the rationale behind these exercises and how they contribute to overall spine health. Dr. McGill introduces the concept of the Biblical Training Week, a balanced approach to exercise that includes strength training, mobility work, cardiovascular exercise, and a rest day. This approach aims to provide a well-rounded fitness regimen while minimizing the risk of injury and allowing for proper recovery. The discussion turns to the controversial topics of deadlifts and squats. Dr. McGill acknowledges the potential benefits of these exercises, but also warns about the risks, especially for individuals with a history of back pain or those who progress too quickly. He emphasizes the importance of proper form and individualized programming based on a person's specific needs and limitations. The podcast touches on the biopsychosocial model of pain, which considers biological, psychological, and social factors in understanding and treating pain. Dr. McGill discusses how this model informs his approach to treating patients, especially those with complex pain histories or trauma. He addresses the challenges of maintaining spine health as we age. He discusses how disc height naturally decreases over time and how this can affect mobility and pain levels. The professor offers insights into how to adapt exercise routines and daily activities to accommodate these changes and maintain functionality. Throughout the podcast, Dr. McGill emphasizes the importance of balancing mobility and stability in spine health. He explains how different activities and sports require varying degrees of each, and how individuals need to find the right balance based on their goals and physical condition. Dr. McGill shares valuable insights on injury prevention and recovery. He stresses the importance of not pushing beyond one's limits and the need for proper progression in training. The professor also discusses how to approach rehabilitation after an injury, emphasizing the need to address the root cause of the pain rather than just treating symptoms. The podcast delves into the crucial role of core stability in overall athletic performance. Dr. McGill explains how a strong and stable core allows for more efficient transfer of force throughout the body, improving performance in various sports and activities. A recurring theme throughout the discussion is the need for an individualized approach to fitness and pain management. Dr. McGill repeatedly emphasizes that there is no one-size-fits-all solution and that treatment and exercise prescriptions should be tailored to each person's unique circumstances, goals, and physical condition. The podcast addresses some of the controversies in back pain treatment, including the effectiveness of certain interventions like inversion tables and platelet-rich plasma (PRP) injections. Dr. McGill provides his expert opinion on these topics, often emphasizing the need for more research and cautioning against overgeneralizing results. He discusses the neurological aspects of back pain and athletic performance. He explains how the nervous system plays a crucial role in movement patterns, pain perception, and athletic ability. The professor also touches on how different types of training can affect neurological adaptations. Throughout the podcast, Dr. McGill offers practical advice for maintaining spine health in everyday life. This includes tips on proper sitting posture, how to lift objects safely, and the importance of varying positions and activities throughout the day. The discussion concludes with some thoughts on the future of spine health and research. Dr. McGill expresses his ongoing commitment to evidence-based practice and the importance of continuing to study and understand the complexities of the spine and back pain,